It's the most popular question on the local mom blogs and Facebook sites. What is this rash and how do I treat it? Moms all over the city have asked this question at some point. And of course, it's not just the kids who get itchy, irritated skin. Adults suffer too.
So we asked Dr. Ryan Shelton with Tryon Medical Partners to help us out and give us the lowdown. How you doing, sir? And welcome to the show.
Doing well. Good to see you guys.
Yeah, we're glad you're here. Okay, so let's talk about some of the most common causes of rashes. The first one, contact dermatitis.
Right.
What is that?
So there are a zillion types of dermatitis or eczema. You may have heard it called eczema.
Oh, that's what it's called.
This is one type, and this is where we come into contact with something that our skin doesn't like. So you could be allergic to it. Some examples are like nickel on a belt buckle or jewelry. You could have worn the same jewelry or belt for a long time, but then develop an allergy to it. So it's poison ivy is another great example. Doing some gardening and then we get like a blistery rash. This one is a latex allergy. This was actually a nurse who wore latex gloves for work and then would touch her face, and so she would develop this contact rash or contact dermatitis.
And again, that can develop. You think that you're fine, but and all of a sudden you're not.
You could have been fine for a long time, and then it develops later.
So how do you treat that dermatitis?
So we want to first figure out, okay, what's causing it. So we try to think about, have you had a new soap, a new detergent, slept somewhere different where you had an exposure to something like a detergent that you might be allergic to, gardening, repetitive water, hand washing, different things. Just depends on where it is on the body. So first thing we want to do is try to avoid the trigger, like get rid of what's causing it. And then to tone it down, we can use anti-itching pills called antihistamines like Allegra or Claritin, and a topical hydrocortisone. This is something I think we ought to keep in our medicine cabinet. It's just over-the-counter hydrocortisone. It's a steroid, and that can be put on the worst spots just to kind of calm it down a little bit.
Is this something that's common in children?
Yeah, this is common all the way up, definitely.
Here's a common thing that I used to do with kids when we were kids. Everybody had ringworm. What is ringworm and what's that skin irritation?
Yeah, so it looks like, it can look like a ring,
worm,
not always.
Okay.
But it's not from a worm. I don't know where that came from. So it's a fungal infection, and this one is on the back of the base of the scalp. You see how it kind of has like a raised, like red, kind of snake-like curvy border?
Yes.
So that's kind of where the ring comes from. So if we have it on our arms, legs, it'll typically be more round and have kind of that raised red border with some scale in the center. But when it's on the scalp, or when it's so jock itch, athlete's foot, it's the same fungal infection. We just call it different things when it's in different locations.
Oh.
Luckily, though, the treatment is pretty much the same.
Okay, what is the treatment?
So it's actually over the counter as well. It's called clotrimazole, is one of the generic names for it. It'll be in the athlete's foot section of the pharmacy.
Like Tinactin?
Yes, spray Tinactin. You could use a spray for the feet. It comes in powder form. We usually use a topical cream, and you have to apply it for a week or two for that to go down. So this is one that it is contagious, but it's not really dangerous per se. So people kind of freak out about this one, but it's very treatable.
Okay, that's good to know. Can we talk about shingles?
Yeah.
That's another common one, and from what I understand, they're very painful.
This is super painful. This is very common, especially in adulthood. As we get a little bit older, our immune system kind of starts to go down. So this is usually on one side of the body, and it's in what we call a dermatomal pattern, meaning it's in a nerve pattern. So the nerves come out of the back and come and wrap around. So it usually never crosses our midline. I mean, it can, but typically not. So that's why you'll see kind of this band-like pattern going around. It can sometimes, or oftentimes, will start with an itchy sensation, like a tingling. You're like, what is this? There'll be no rash initially, and then you may develop the red kind of vesicle. That's kind of a more advanced stage one that we showed you. But sometimes it'll start with just kind of a mystery of, I'm just kind of burning and tingling in this one area.
So if I had chicken pox as a kid, I wouldn't get shingles? Is that
No, you could. It's basically, what it is basically is a reactivation or an awakening of the chickenpox virus. And most of us, whether we either fully had chickenpox as a kid, or you probably had enough exposure to everyone else that you developed an immune response to it anyway. So most people are really at high risk for shingles.
So quickly, what's the treatment for shingles then?
So if we catch it early, which is the key, we use an antiviral medication to really kind of tone it down. It's not necessarily going to cure it, but it will decrease the symptoms, decrease the likelihood that you could have some persistent nerve pain in that pattern, like long after the rash is over. So the timing is key on that. So within 3 days, it works best. Sometimes we use a steroid. It just depends. But there is a new vaccine that's actually quite good that I highly recommend for people over 50. That's new now. It's a 2-shot series, and this will significantly decrease your chance of getting shingles over your lifetime.
That's
I
good
like
to know.
that.
It's called Shingrix. It's hard to find in the pharmacies right now. It's been on a little bit of not back order, but it's hard. It's high demand, so it's hard for them to keep it supplied. But it is one that is well worth doing.
At what point should someone see a doctor and be concerned if they have a rash, that's not going away?
If you see one that's in that band-like pattern, we need to see you then, because the sooner we get you on the medicine, then that's the prime opportunity to turn down the shingles risk. But if it's all over your body, if it kind of starts out all of a sudden and is everywhere, and it's very kind of quick, then we need to see you. If you have a fever with it, and if you start to have any areas that are really red or kind of crusty or oozing, or any red streaking above the rash, that means it could be secondarily infected. Also, if it starts to blister suddenly, that could be shingles or a herpetic type rash. So those are some things that we need to see you then for that.
Absolutely. Dr. Ryan Shelton, thank you
sir.
very much.
Welcome.
For more information, check out tryonmed.com, tryonmed.com. While you're here, will you just...
Okay, Colleen.
Definitely not shingles.
I'm gonna have to move.
You're allergic to your microphone.
That's what it is, yeah.